This used to be me. I was on the YouTube for the longest time, searching everything that I could find about Accutane and Isotretinoin before I decided to take this drug. And I have seen hundreds and thousands of miracle and horror stories. I have lived both sides. Hi everyone, I'm Dr. Chiyen, a doctor working in Malaysia who has special interest in dermatology. I am also someone who has spent a whole year in isotretinoin. The purge, the dry lips, the slow progress, the relapse, I had went through it all. In this video, I'm not just going to list facts, I'm going to give you everything about isotretinoins, about how it works, who is it for, side effects, and what I wish I knew before I started. And I'll sprinkle in my own journey throughout this video so that you know that I'm not just reading from the textbook, but I have taken every single pill. Let's start with the most important question. What is isotretinoin or Accutane? Isotretinoin, often called by the original brand name Accutane, is a retinoid, a derivative of vitamin A. But it is not your average cream, it is a systemic medication that works from the inside out. Here is the science. It targets all four causes of acne at once. 1. It shrinks your sebaceous oil glands and drastically reduces the oil production. 2. It normalizes the skin cells shedding process so they don't clog pores. 3. It indirectly reduces the Cutibacterium acne bacteria. 4. It has an anti-inflammatory effects. No other acne drug does all four. That's why isotretinoin is such a powerful drug. It is usually reserved for severe nodular cystic acne and treatment-resistant cases. Who is isotretinoin for? Not everyone with a few pimples requiring isotretinoin. Guidelines, including the one that I use as a doctor, recommended isotretinoin to three main groups of people: nodular cystic or severe acne, those big, red, painful cysts that can leave scar; treatment-resistant moderate acne, after trying oral antibiotic, topical retinoid, and benzoyl peroxide, and they still fail; acne that causes severe scarring or serious psychosocial issues, meaning that it is affecting your mental health, confidence, and your daily life. In my case, I had severe nodular cystic acne covering my whole face. I tried topical medication and oral antibiotics for months, but zero improvement. I was losing hope. That was when my dermatologist and I decided that this was time to start isotretinoin. I was terrified of the side effect like you, but I was even more terrified of living another year with that pain. Dosing: low dose vs conventional dose. Isotretinoin dosing is based on your weight. The traditional goal is a cumulative dose of 120 to 150 mg per body weight over a span of 4 to 6 months. That usually means 0.5 to 1 mg per kg per day. This means that if my weight is around 50 kg, then I'm supposed to take around 50 mg of Accutane per day in 2 divided doses. But here is what is interesting. Recent evidence, including Cochrane review and also our local guidelines, suggested that a low dose of isotretinoin, which means 0.25 mg to 0.4 mg per kg per day or 10 to 20 mg per day, is just as effective for many people with fewer side effects. And the low-dose isotretinoin is what we practice in Hospital Malaysia. Here is my own personal experience. My dermatologist initially started me on a very low dose of Accutane, 10 mg daily. After 6 months, my forehead cleared, but my cheeks were stubborn. Then my dermatologist increased my Accutane dose to 20 mg daily for 2 more months. However, still no improvement. I was devastated. My doctor added me on another oral antibiotic, and this was when my skin finally turned around. Why am I telling you this? Because isotretinoin isn't always a straight line. Some people may need low dose for longer, some people might need combination, and some people might need a second course later. And I hope that the people who need to go through it have the patience to take the pill every single day until the acne improve. Side effects. Let's talk about the side effects because I know this is what scares most people. I'll break it down into 3 groups. The first group is the side effects that are common but manageable. Dry lips. I had this from day 1. Vaseline became my best friend and I apply Vaseline on my lips every single night before I go to bed. Other side effects are dry skin, dry eyes, nosebleed. They are common but temporary. Accutane can increase sun sensitivity. You will burn faster. So daily sunscreen is a non-negotiable. Group number 2, common but dose-related side effects. Muscle ache, joint pain, especially with higher doses. Temporary increase in cholesterol level. That's why we monitor your blood every 1 to 2 months. Group number 3 is rare but serious side effects. Acute liver injury. Isotretinoin can cause elevated liver enzyme and can cause acute liver injury in rare cases. Patient might experience mild increases in the liver enzyme. These changes are typically reversible with dosage adjustment or with discontinuation. That's why we need to do regular blood tests in order to detect and manage the risk early. However, prolonged use and higher dose of Accutane can increase the risk of sustained liver injury. Hence, it is critical to adhere to doctor's guidance and monitoring protocol. However, please rest assured that mild elevations of liver enzyme are usually more common and usually harmless and reversible. Another rare but serious side effects is mood changes. I will dedicate a full sections to this because it is controversial. I was lucky. On 10 mg, my only side effect was dry lips. Even on 20 mg, I didn't experience joint pain, depression, or back pain. But I know some people need to stop because of the side effects that they experience. The key is start low, go slow. That's exactly what my dermatologist did. The depression debate. Does isotretinoin cause depression? I have read the studies. The guidelines that I'm using in Malaysia states that the causal link is controversial. Rates of depression range from 1 to 11%, similar to antibiotic control group. But here is what we know. Acne itself causes depression. Severe acne is a devastating disease. When patients start isotretinoin, the acne might get worse in the first month, and this is what we call as purging phase. If someone is already depressed, that worsening acne might push them over the edge. So what you should do? Be screened for depression before you start the medication. Tell your dermatologist if you have a history of mood disorder. Have a support system. And this helped me tremendously. Exercise. I went for runs to help release endorphins, and I believe it helped to protect my mental health while I was on purging phase. If you feel hopeless or have thoughts of self-harm, stop the medication and reach out for help immediately. That's not weakness, that's safety. The absolute contraindication, pregnancy. This is the most serious risk. Isotretinoin is a teratogen and it can cause severe birth defect. Even one single pill taken during pregnancy can lead to cleft palate, skull and ear deformities, heart defects, and premature birth and miscarriage. It should not be used in female patients who may become pregnant. Contraception should be discussed when considering isotretinoin. Women of childbearing age must commit to strict contraception measures starting 3 months before the treatment and 1 month after the treatment. For a guy, there is no proven risk to the partner, but as a safety measures, many doctors still advise avoiding pregnancy during treatment. I was single back then in 2018, so I didn't have to face this. But as a doctor, I have counseled the patient to delay the treatment as they couldn't commit on the contraception. It is a serious decision. Also, you cannot donate blood while on isotretinoin and for at least 1 month after. The drug stays in your blood and could harm a pregnant transfusion recipient. Monitoring and lifestyle while on isotretinoin. Your doctor will check your liver function and liver enzyme before starting medication and monitor regularly. If your liver enzyme and cholesterol is going up, they might suggest to reduce the dose or adjust the dietary. What you can do if you decided to take isotretinoin, you can take the medication together with a fatty meal. It is a lipophilic drug. Fatty meal can increase the absorption of the medication. Avoid taking alcohol because your liver is already working on the medication. Avoid waxing, laser hair removal, or harsh pills because your skin is already fragile while on Accutane. Use a gentle cleanser and a high SPF sunscreen every single day. For me, while I was on Accutane, I also cut out sugary food and dairy products during my course of isotretinoin. Did that help to cure acne? No, but I believe it can help to reduce inflammation and help to improve my overall health. And exercise kept my mood stable. Purging, relapse, and what to expect long term. The purging phase, when your acne getting worse before starting to get better, happens to around 30% of patients, especially for the ones starting on a higher dose. I have gone through the purging phase by myself. It was demoralizing. Till this day, I still can clearly remember the reaction of other people and the hurtful comment that they have made when they saw my face fully covered with inflamed acne. But I know I need to stick with it, and after a few months, my acne finally showed improvement. After you finish a course of Accutane, about 50% of patients will have a long-term clearance. However, the other 50% might have a relapse and need a second course of Accutane, especially if you have hormonal acne, very oily skin, and a family history of acne. I had a strong family history of acne in which my father and his family all had severe acne. My skin is very oily also. Even though I was clear for a while after stopping in December 2018, but then I experienced mild to moderate relapse after I stopped Accutane. I didn't go back on isotretinoin. I managed with diet, lifestyle changes, and topical treatments. That's a video for another day. But the point is, isotretinoin is not always a one and done miracle, and that is okay. Can isotretinoin improve scars? This is a question that I get all the time. Does Accutane erase all scars? No, but it can prevent the formation of new scars by stopping the new active pimples. And over a long period, months or years after stopping isotretinoin, some people notice mild improvement in the existing scar because isotretinoin can remodel the deeper skin structures. But let me be honest with you, I still have boxcar scar, ice pick scar, and rolling scars on my face. Isotretinoin cleared my acne, but it didn't erase the past. That's why I'm learning every single day about the skin diseases as a doctor to help people like you and me. My advice as a doctor is to start Accutane as soon as possible to prevent the formation of new acne, and hence it can prevent the formation of scars. Who should not take isotretinoin? Isotretinoin is not for everyone. Avoid it if you are pregnant, planning pregnancy, or cannot reliably use contraception. Avoid if you have very severe liver disease. Avoid if you have a history of depression or suicidal ideation without a good support system. Now, let me explain how actually is isotretinoin prescribed here in Malaysia. In Malaysia, isotretinoin is a prescription-only medication, meaning that it cannot be obtained over the counter. Its use is tightly regulated due to its potential severe side effect, especially in pregnant women, because isotretinoin is teratogenic. Only qualified doctors can prescribe isotretinoin after a thorough assessment. They will evaluate your acne severity, discuss potential severe side effects, determine the appropriate dosage and the treatment duration, provide ongoing monitoring through regular follow-up, including regular blood tests like liver function and lipid levels. Isotretinoin changed my life. It gave me clear skin when I thought it was impossible. But it is not a decision to take lightly because the side effects are real and the monitoring is strict. If you have severe scarring or treatment-resistant acne, talk to your skin doctor. Ask about low-dose isotretinoin and be honest about your mental health and pregnancy risk. What I want you to remember is you are not your acne, your skin does not define your worth. Whether you take isotretinoin or not, there's always hope. I'm Dr. Chiyen. I make videos about acne, skin diseases, and my journey as a doctor in Malaysia. Thank you for trusting me, taking care of your skin and your mind. I'll see you in the next one. Bye.